Welcome students, I am Dr. Naveen. Let us solve this MCQ now. Superantigens bind to. So they are asking where the superantigens bind exactly. The options are alpha beta heterodimer group of MHC molecule, complementarity determining region 1 of the alpha chain or beta chain, and one more region, CDR4 of the beta chain of T cell receptor. So before starting this, I would like to tell you something. The superantigen concept is very important for PG medical entrance examination because to understand this, the student should first know where exactly the antigen bind, normal antigen. Then we'll go into the superantigen binding location. Along with that, the student should understand what is the structure of a MHC molecule. MHC has two components, MHC1 and MHC2. And also the student should know what is the structure of the T cell receptor. So how MHC and T cell receptor they interact, and also what is the structure. So let's go into the details. So before going into the details, I would like to brief you something about superantigen. So there was one syndrome known as toxic shock syndrome. So the superantigen concept has taken its origin from this syndrome known as toxic shock syndrome. You know, whenever there is a microbe entering into the body, most of the times the body responds with an inflammation. That is, inflammation because of cytokine release. Whenever cytokines release, they cause fever response. In some cases, they also cause rash. But in few conditions, because of the infections with Staph aureus and also Streptococcus pyogenes. So few of the bacteria, I am giving you two examples here. Whenever there is infection with Staph aureus and Streptococcus pyogenes plus some of the risk factors like usage of vaginal tampons is one of the risk factors. So whenever there is a risk factor and infection with these few bacteria, along with fever and rash, the patients are also presenting with shock, that is hypotension and also skin peeling. So what is this condition which I explained you? This is toxic shock syndrome. And what is the basic reason behind toxic shock syndrome? Here, the toxic shock syndrome is produced by interaction of superantigen, the microbe releasing superantigen, and this superantigen causes non-specific, this is not a specific response, it is non-specific activation of T cells. So this again leads to T cell activation. Why this is happening? That is, polyclonal T cell activation is happening, and this T cells causes cytokine release which is massive. So I'll start again. So whenever there is an infection with a particular kind of bacteria along with the risk factors, the body is responding in a weird way. That is, there is a massive cytokine release. And why this is happening? This is because of the polyclonal T cell activation which is non-specific. So this is superantigen. And I already told you to understand the interaction of superantigen with the T cell receptor and MHC class 1, we should know the structure of MHC and also T cell receptor. So now I am starting with the structure of the MHC. See, MHC has two variants, MHC class 1 and MHC class 2. And MHC class 1, you have to remember alpha, there are 3 alpha and 1 beta 2 microglobulin. See how these 3 alpha are arranged? Let us say this is the antigen presenting cell, and you will see alpha 1, alpha 2, alpha 3 and beta 2 microglobulin are heterodimer group arranged like this. And this site is the antigen or protein binding site. And MHC class 2 has alpha, that is 2 alpha and 2 beta. See this? alpha 1, alpha 2 and beta 1, beta 2. So these are the structures of MHC complex. And when it comes to T cell receptor is bound to the T cell. So this part is T cell, and you can see it has, yes, the variable region which is towards the antigen binding site and constant region which is towards the T cell surface. So this has alpha and beta chains. And if you go into more microscopic structure of these alpha and beta heterodimer chains, you will find the complementarity determining regions. What are these? The complementarity determining regions which are present in T cell receptor. And you can see the alpha part has 3, that is complementary determining regions 1, 2 and 3. Whereas the beta side has, along with 1, 2 and 3, a special or one more complementarity determining region, that is CDR4. And this CDR4 has significance in case of superantigens. What is the significant? You will know it soon. So next thing is, as I told you, now you know the structure of MHC2 and the T cell. And see, whenever there is a normal antigen, the antigen is taken up by the antigen presenting cell and it releases some protein, okay, minute amount of the protein, and this protein is bound to the alpha and beta heterodimer groups. So it is bound both by the MHC and the T cell receptor in the center. You can see this. So whenever this happens, there is T cell activation and release of the cytokines. So cytokines released. So this is regular amount of cytokines which are released here. And this slide shows it's the same thing, same situation. Antigen or microbe is taken up and a peptide is released, but there is no binding of this antigen here. What happens is the super antigen which is released is bound to the beta region, that is the beta region, that to the variable region of the beta of T cell receptor. When I want to go into more details, which part of the beta receptor? It is the CDR4, which is not taking any part in case of normal antigen, but it is very important in case of superantigen. Very important in case of superantigen. So let us go to the question again. Superantigens bind to. So here the question, it says superantigens bind to alpha beta heterodimer group of MHC molecule. So this alpha beta heterodimer group, normal antigen binds here. Okay, CDR1 of the alpha chain of T cell receptor and beta chain of T cell receptor, they also form a loop again, and this loop is again bound to the normal antigen. But when it comes to CDR4, which is not involved in normal antigen response, whenever a super antigen comes, it directly binds to CDR4 of the beta chain of T cell receptor. So what is the answer for this question? Superantigens bind to CDR4 of the beta chain of receptor. That to which region? The variable region of the beta chain of the T cell receptor. Because of this binding, there is polyclonal T cell activation leading to massive release of cytokines. And this massive release of cytokines produce a syndrome known as toxic shock syndrome. So this is the final conclusion.